Hello friends, I am Mr. P.K. Das, Associate Professor in Special Education. I am discussing about the temper tantrum behaviors and its modification or management in this YouTube video. What is the meaning of temper tantrums? It is an uncontrolled outburst of anger and frustration typically seen in young children. The child has a temper tantrum means that child cannot get his own way. So temper tantrum are a way of express frustration. Whether it is learned behavior or not. For younger children, temper tantrums are a normal development at the age or around the age of 2 years. But it is seen after 5 years, then it is concern. For older children, temper tantrums may be a learned behavior. In special education, we found learning to play plays the biggest role in developing problem behavior. Parents often reward unacceptable behavior in ignorance. In order to stop the behavior, parents giving the child all their attention sometimes try to bribe the child with some dolls. If you reward a temper tantrum with something your child wants, you allow your child to get out of things by throwing temper tantrum, the temper tantrums are likely to continue. These are a part of normal development around the age of 2 years, but after that it is problematic or undesirable behavior. The first sign of temper tantrum is seen by holding breath in young children. But in older children, we see like screaming, hitting, kicking objects or things or person, etc. Then what is the reason of temper tantrum? Sometimes child's condition like hunger, fatigue, tiredness also develop temper tantrums. Another reason is inconsistent discipline. That means there is a flexibility in home rules. Families are not maintaining the home norms and rules perfectly. That also responsible for development of temper tantrums. Some physical illness or disorder also causes temper tantrum, like asthma, congenital heart disease, or a disorder like ADHD, hearing impairment, visual impairment, cerebral palsy develops temper tantrum behavior. Critical, anxious, and nagging adult also stimulating the environment which develops temper tantrum. How we manage it? Then this is the question arise in our mind, that is how to manage or modify the temper tantrum behaviors. Weak and ill children are generally bad tempered. Children's condition and physical illness disorders are rolled out by consulting with physicians. Then counseling, another method. Critical, anxious, and nagging adults are to be counseled, not to create the environment or a situation which stimulates problem behavior. Another management criteria is consistent home discipline. That means you have to firm in maintaining the home rules. And another management point is that is time out behavior modification technique to manage temper tantrum is very much useful technique or strategy to modify the temper tantrum behaviors. Then what is the time out technique? When we apply it, we go through some steps. The first step is record the undesirable behavior, what happened before, during, and after the behavior for a week. Then step 2. After recording, you examine the records to see the pattern, situation, and the result of the behavior and how the behavior is being rewarded. It is very much necessary for the therapist or teachers or parents. Then step 3. When undesirable behavior occurs, do not scold or argue or discuss with the child. Just you remove the reward. If it is your attention, stop immediately. If it is an object, remove it. If you think the situation is rewarding, then remove the child immediately and take him or her to the another room where he or she do not damage anything, and leave him or her for 3 to 5 minutes. No matter how much she or he screams. After that, you let him or her out at the moment when he or she is not screaming. In this method, the child's unwanted behavior is ignored completely. When the temper tantrum occurs, the child is attended to only when the behavior is completely vanished. This is very much effective technique. You may also use in at home or at school. Thank you, friends.